Good afternoon, Gerald Strauss. My name is Mihiraa. Let's start the warm-up session. What are the qualities that a nurse should possess?
Of course, a nurse should possess a variety of qualities. First of all, she should possess excellent communication skills which help them not only to gather clinical data but also to maintain an effective relationship with other team members. Secondly, problem-solving and critical thinking skills are essential for nurses to deal with emergencies and difficult situations. Other qualities such as punctuality, dedication, honesty, and competency are also pivotal for nurses.
Do you have a role model?
Yes, I do. My role model is my mother. I follow many things that my mother does. It is from my mother I learned the basics of kind behavior, decision-making, and organizing skills, a polite and humble manner, helping and sharing mentality. The care and respect she gives to everyone makes me wonder sometimes. She is a perfect example of womanhood. I believe a nurse should possess all these qualities. She is my superhero.
Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here nurses are paid well and respected too. In addition, I have many friends and relatives over there so they can help me during my initial days.
What are the current trends in your profession?
Nursing is a dynamic profession and changes happen daily. Nowadays technology plays a vital role in my profession. For instance, paper records that we used in older days have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in present days a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
What are the pieces of advice for the upcoming nurses?
As a nurse, I can give a bunch of advice to upcoming nurses. Firstly, I advise them to love their profession. If anyone loves their profession, they can carry out their responsibilities in an efficient manner without complaints. Apart from that, I advise them to be dedicated to their profession and maintain professional standards. These are very essential because a nurse should abide by nursing ethics on any grounds. These are a few pieces of advice that I like to give to future nurses.
Your preparation time is over. You can now start your roleplay.
Good afternoon, I'm Gerald, one of the nurses here. I can see that you're in a lot of discomfort right now. May I know the reason for your visit to the emergency department, please?
My doctor referred me here with suspected appendicitis. The pain is unbearable.
I'm really sorry that you're going through this, but we'll do our best to take care of you. Well, may I know your name for the documentation?
Yes, my name is Mihiraa.
Alright, thank you for letting me know, Mihiraa. It sounds like you're having a tough time with the pain. I'm here to gather some more information about your condition, and after that, I'll explain what we'll be doing next to help you. Let's start with understanding your pain a bit better. So, can you tell me a bit more about the pain you're experiencing?
Well, it started last night, around 8 p.m. The pain started off dull, but now it's sharp and mostly on the right side of my lower abdomen. I'd say it's a 9 out of 10 right now, and I feel nauseous too. I haven't vomited, but it feels like I might.
Thank you for sharing that with me, Mihiraa. Based on what you've told me and the suspected appendicitis, let's discuss the next steps to ensure you receive the best possible care. The first step is to schedule an appointment with a specialist who can conduct a thorough examination and determine the best course of action. We may need to perform some tests to confirm the diagnosis and assess the severity of the condition. Depending on the findings, surgery may be necessary. If so, we'll discuss the procedure in detail and prepare you for the process. You'll likely need an 4-line during the surgery to administer fluids and medications to help manage the pain and prepare you for surgery. Our team will be there to provide support and ensure your comfort throughout the entire process.
Nurse, it's going to be a long procedure. What if my appendix ruptures before they figure it out? I'm really worried about that.
Mihiraa, I can see you're really worried about the possibility of your appendix rupturing, and that's completely understandable. If your appendix does rupture, it's treated as an emergency. You would need urgent surgery to remove the appendix and prevent any infection from spreading inside your abdomen. After the surgery, you would likely stay in the hospital for a few days, so we can monitor you closely and give you antibiotics to help with recovery. Now, the surgery itself might be done using a method called laparoscopic surgery. This involves making a few small incisions instead of one large one. The surgeon would insert a tiny camera through a tube to see inside your abdomen. To make things easier for them, they would inflate your abdomen with carbon dioxide gas using a small cannula, which is a narrow tube. This gives a clearer view of the appendix, making the surgery safer and more precise. Do you have any other questions or concerns about the surgery or anything else?
Okay, I understand, but the pain is just unbearable right now. Can you give me some pain medications, please?
I'm really sorry to hear how much pain you're in, Mihiraa. I know it's hard to wait. However, we need to wait for the doctor to examine you before we give you any pain medication. This is because some medications can affect how we assess your condition. In the meantime, can you tell me if you've taken any painkillers so far?
I took 2 ibuprofen tablets about an hour ago, but they haven't helped at all. Well, nurse, how long will it take to see the doctor?
Thank you for telling me. Based on that, the doctor will factor it into their assessment. In terms of waiting, the doctor will definitely take your pain level into consideration when making decisions about your care. I know waiting can be difficult when you're in pain, and I apologize for any inconvenience. However, because we suspect appendicitis, you have priority status, which means you won't have to wait too long. We're keeping a close eye on your condition, and if your symptoms worsen, we'll move you up the list immediately. Please don't hesitate to let me know if you need anything. I'll be nearby to assist you in any way I can.
Okay, thank you. I just hope the doctor gets here soon.
You're welcome, Mihiraa. Hang in there, and will get you the help you need as soon as possible.